Marissa. Thank you so much for having me today. So basically, an oncology dietitian works with cancer patients and their families to develop a diet during chemotherapy, radiation, as well as surgery, if surgery is needed in a specific case. And we help patients basically adjust their nutritional intake to optimize health and healing and to minimize the side effects caused by cancer and cancer treatments. So the plan often will include lots of fruits, vegetables, lean proteins, but it may also include a lot of surprising foods like gravies or milkshakes, which normal dietitians don't tend to usually prescribe. So for example, if we get a patient who has lost lots of weight, maybe 10 kilos during chemotherapy, then we obviously need to try and increase their body mass. So oncology dietitians will then offer specific calorie and protein benchmarks for those specific patients. And then oncology dietitians may also offer simple, practical tips and advice to help patients achieve their nutritional needs, advice on how to deal with weight loss, weight gain, fatigue, nausea brought on by the illness, as well as any other treatment side effects, personalized guidelines based on a person's biological needs and unique circumstances, plans for families, and then we often talk to caregivers as well, and then we often give recipes and lists of food to the patients. And we do recognize, in the early days of cancer diagnosis, that you're often bombarded with so much information from everyone and everywhere on what to eat and how to eat and when to eat. So we're not here to add any extra pressure. We want to try and make your life a lot easier. So we aim to provide you with the knowledge and tools to make informed decisions around diet and cancer based on all the latest evidence and research.
That's actually one of the reasons why I did not contact a dietitian when I was diagnosed. I mean, there's really so much information that you go, oh, but I'm healthy. Because I mean, I wasn't sick at the time. I'm healthy. I'm not going to need this. I'll be fine. Until I gained 20 kilos during chemo. And I went, oh, okay, So it's actually time to contact a dietitian.
Shame.
That brings me now to that next question. Why is nutrition essential at the onset of breast cancer treatment? And that's the one thing that I really neglected. And I wish I knew the importance of it.
Yes, for sure. So good nutrition is very important if you have cancer, because both the illness and its treatments can actually change the way that you eat. And cancer treatments also affect the way that your body can tolerate certain foods, as well as how it uses different nutrients. And eating well, just from what I've found and, with my patients, is that it helps them to feel better. It keeps up their strength and their energy levels. It helps to maintain their weight. So we don't want them to lose weight. We don't want them to gain weight. It also helps to lower the risk of infection because the immune system is also lowered. And then it also helps them to heal and recover faster, as well as better tolerate the treatment side effects. And there's also that risk factor of gaining weight on certain treatments like tamoxifen for breast cancer. So it's very important to get started earlier on into a well-balanced diet and exercise routine. So that's why it is good, to try and see a dietitian from the onset.
That's the first thing when I speak to people. If there's a woman, if someone contacts me and talks to me about breast cancer as a newly diagnosed patient, I said, that's the one thing I neglected. Please don't do the same thing. Because one tends to read so much. And, I think that is the other thing that I get to. We tend to want to know more. So we go to Dr. Google, and what Dr. Google then does, it tells us about the keto diet, intermittent fasting, all these Herbalife eating plans, everything that's out there, that all these, I want to call them fad diets. I'm sorry if they're not. But I mean, why is it better to consult a dietitian than following a diet that you found on the internet?
Yeah, no, that's also a very good question, Em, and I get that question quite often. So the nutrient needs of people, with cancer vary from person to person. So not one thing is going to fit everyone. So navigating all that information around diet and cancer can be very, very overwhelming for patients. I'm sure you did all that research. You don't know which one to trust, which one is correct, which one is factual. So because there's a lot of information, it can actually do a lot more harm than it does good for the patients. So as a dietitian, we actually have to keep up with all the latest evidence-based research. So not just anything that lands up on Google. And then we help patients to unpack these controversial topics in a balanced way. And then we offer them the correct information so that they can make the decisions that are going to work for them or for a person individually. And despite what you may have read on the darkest depths of the internet, there's not one specific food or dietary pattern of eating that directly causes or cures, for that matter, cancer. So there's actually no need to be very overly restrictive with your diet. And we want to, rather find what works for the patient and find more of a well-balanced eating regime that is going to work for them on an individual basis.
Yeah. A quick talk about supplements.
Yes, good question.
I know it's so easy. I speak to a few fitness fanatics, and because life is so busy, people tend to say, okay, I don't have time to eat, so I'm just going to pop a few multivitamins. Talk to me about supplements in terms of specifically breast cancer.
Yes. So a lot of patients do come and ask me, should they be taking vitamin C and zinc and folic acid and coenzyme Q10? And actually what the researchers suggest is that it sort of lessens the effect of the chemotherapy. So these high antioxidant supplements like vitamin C, like zinc, like omega-3s, coenzyme Q10, it actually hinders the effect of your chemotherapy. So you'll see a lot of your oncologists actually tell patients to not take any of those type of supplements. The one supplement that they do often recommend is vitamin D. It's a fat-soluble vitamin. And a lot of patients do find it helps them with their energy levels or their strength, or because they're not going outside a lot, if they're not feeling well, then their vitamin D levels also, go down. So there are some supplements that if you need it, if you are iron deficient or vitamin D deficient, that you can definitely take safely, but it's more that those high potency antioxidant ones that we need to be very careful of. And then I usually tell patients, rather spend your money on buying the fruits, the vegetables, the whole grains, and rather getting all your nutrients directly from food itself, because you're also then finding that you're getting the fiber as well. Supplements are not going to give you the good fiber that you would get from an orange, for example.
Okay, thank you very much. Thank you very much for joining us this evening. Do you have any closing remarks, anything you want to close with that is important?
So remember, dealing with cancer is enough pressure for anyone. So I usually tell patients, just try to be as kind as possible to yourself when you're thinking about what food to eat. Food should be a pleasure as well as something to fuel your body with. So enjoy what you're eating when you can, and try not to beat yourself up if you're eating what you think, you shouldn't be eating. And if you decide that you do need to change your diet, rather speak to a registered dietitian before embarking on any new plan, because we can help you assist in meeting your individual needs, and we can also help you through any of the side effects that you may experience.
Wonderful, Meagan. Thank you very much. Tell me, are you on social media by any chance?
Yes, I am. We are Thrive Dietitians, or you can also find us on Facebook, Thrive at L&M Dietitians.
Wonderful. Thank you very much. I really appreciate your time. Have a good evening further.
Thank you so much. Have a good evening. Thank you.